Welcome to TCM Board Formula Series. Today we review Zhen Tang, 8 Treasure Decoction. It belongs to the category Tonifies Qi and Blood. The fastest memory hook is this: 4 gentlemen plus 4 substances, rebuild Qi and Blood together. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Ren Shen, strongly tonifies source qi. Bai Zhu, strengthens the spleen and dries dampness. Fu Ling, supports the spleen and leaches dampness. Zhi Gan Cao, augments qi and harmonizes. Shu De Huang, deeply nourishes blood and yin. Bai Shao, nourishes blood and preserves yin. Dang Gui, nourishes and gently moves blood. Chuan Xiang, moves blood within a tonifying formula. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Ren Shen and Shu De Huang. The deputy level is Bai Zhu and Bai Shao and Dang Gui. The assistants are Fu Ling and Chuan Xiang. The envoy role is Zhi Gan Cao. Together, the formula Tonifies Qi, nourishes blood, restores support without allowing rich herbs to stagnate. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is concurrent qi deficiency and blood deficiency. Look for this clinical picture: fatigue, low voice, poor appetite, pale or sallow complexion, dizziness, palpitations, shortness of breath, scanty or irregular menses when blood deficiency is prominent. The tongue is pale, often thin. The pulse is thin, weak, or deficient. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Si Jun Zi Tang a Euro mainly Qi deficiency, no strong blood deficiency picture. Si Wu Tang a Euro mainly blood deficiency, less fatigue and digestive weakness. Shi Chuan de Buletin Tang a Euro adds warming support when Qi blood deficiency includes marked cold. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: a rich tonic, use caution with food stagnation, damp accumulation, or an unresolved exterior pattern. Review pregnancy status and abnormal bleeding before use. Stop and reassess if bloating, nausea, rash, or new bleeding occurs. Modern medication review includes: Dang Gui and Chuan Xiang warrant a medication review when anticoagulant or antiplatelet drugs are used. Zhi Gan Cao contains licorice constituents. Monitor blood pressure and potassium risk with prolonged or high exposure. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1, 8 core herbs. Number 2, Si Jun Zi Tang and Si Wu Tang. Number 3, pale tongue. Number 4, thin or weak pulse. Number 5, Qi and blood deficiency together. The one-line recall is, 4 gentlemen plus 4 substances, rebuild Qi and blood together. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Zhen Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.